So today I'll be talking about the objective structured clinical examination or the objective structured physical examination that you can come across in your ENT examination. Now I have brought in a few model questions, like you will be shown a picture and you may have to write the answers to the point, absolutely what is being asked you must write that, or you may even have to answer oral questions along with that. So coming to the first model question that I have, so this is a as you can see, this is a picture showing a tympanic membrane perforation. So this is the perforation. Now since the lateral process of malleus is oriented like this, and this is more or less the region for the cone of the light, so this will be your right tympanic membrane. So identifying the side of the tympanic membrane is very important, and since this is a perforation, we have to answer diagnosis, it should be a right chronic otitis media with a central perforation. So you need not go into details about the medical treatment and the surgical treatment. You will directly answer this question as a type 1 tympanoplasty. So your answers of OSCE questions will be absolutely to the point. And you may be asked cross questioning about chronic otitis media, about tympanoplasty. Please go through my other videos on chronic otitis media and tympanoplasties to give better answers to those cross questions. Now coming to the second picture, first it is very important to identify. See, this is a diagnostic nasal endoscopic picture of showing, see, this is the thinned out middle turbinate. And so this is the region of the maxillary antrum. So you can see a polypoidal mass coming out through it. So you can write in the diagnosis, you can directly write nasal polyp for your level. So for management, since it is to the point, the best management, you should write a functional endoscopic sinus surgery. Now this is also a similar kind of pathology, like this is again a nasal mass, and see the gross pattern, like grape like thing. The best diagnosis that you can give here is the rhinosporidiosis. And for management, again to the point, you should write about wide local excision with cauterization of base. Now you need not write the medical management here, but you must remember that dapsone has a role if you may be asked in cross questioning. So directly I'm going into the picture. So this is the question is identify the device shown. So here you have to write this is a tracheostomy tube. Now mention the operation. So it is obviously a tracheostomy. Now here you need to know about the cross questions related with tracheostomy. You may be asked about elective tracheostomy. You may be asked about emergency tracheostomy. What is a high tracheostomy, what is a mid tracheostomy, and what is a low tracheostomy. And if you can answer these questions properly, you may be even asked about the complications of tracheostomy. See then again coming to the next picture, I'll try to answer to the point. So you can see this thing, what is the procedure done. So it will be short, it is an anterior nasal packing. Okay, so what is the indication? It will be as simple as that. You should write epistaxis. Now here you may be asked about the causes of epistaxis and how will you treat epistaxis. And again this then coming to the next picture, as you can see, this is the identifying point. So what to diagnose? This is a preauricular sinus. So preauricular sinus is a congenital anomaly, and it has no role in medical. It has no medical treatment. Only if the preauricular sinus is infected, you may treat the infection with antibiotics. The ultimate treatment is excision of the sinus tract. Then coming to the next pictures, as you can see, again, like I mentioned before, it is very important to determine the site. See, the lateral process of malleus is like this. This is the cone of the light. So this is a right-sided tympanic membrane. So you must always be able to identify the side of the tympanic membrane. So to coming to the diagnosis, as you can see, there are bubbles right behind the tympanic membrane, and it is seeming bulged out overall. So this is a otitis media with effusion, or a serous otitis media, or a glue ear. Now, how will you treat the condition? There's both medical management and surgical management. Now, here, to answer to the point, it is better to write myringotomy with grommet insertion. For medical management, nasal decongestants have a role, and antihistaminics. Then coming to the next picture. So this is basically a follow-up of the previous picture, the treatment of chronic otitis media. So this is the grommet. Now remember, this is a left tympanic membrane. See the lateral process of malleus, and we always insert the grommet in the antero-inferior quadrant. So this is a left tympanic membrane. So this is the treatment you provide in otitis media with effusion, like I said in the previous picture. Then coming to the next picture, it is saying state the pathology shown, like it has been marked in yellow. So this is the nasopharynx region. So this would be your adenoids, also known as the nasopharyngeal tonsils. So the pathology would be adenoid hypertrophy. So the patient will present to you with adenoid facies, mouth breathing, and since adenoid hypertrophy is most commonly associated with chronic tonsillitis, so it will also present with a chronic throat pain and difficulty in deglutition, dysphagia. Then coming to the next picture, so as you can see, it is audiogram is being shown. So what is the test shown in the picture? You have to write pure tone audiometry, and the graph is an audiogram. See, they have asked for the diagnosis. As you can see, this is the 2000 Hertz frequency, and you can see a dip in the bone conduction curve. So this is a Carhart's notch. So the diagnosis would be clinical otosclerosis involving stapes footplate. Now a similar type of curve that you may be asked, I have shown a similar diagram. See, this is not the two tracings of bone conduction and air conduction. This is basically a tracing of the right ear and the left ear, and you can see a notch in the 4000 Hertz. Now this notch will be, you will get this notch both in the bone conduction as well as in the air conduction. So this is a sensory neural hearing loss first of all. So and there won't be any AB gap. This is also termed, like the diagram has already shown, it is an audiometric notch and it is found in noise induced hearing loss. So to give the diagnosis of this picture, this would be a left sided noise induced hearing loss. Then coming to the next picture, see, I have already taught you how to determine the side of the tympanic membrane. So this is the lateral process of malleus and this is the cone of the light. So this would be your left tympanic membrane. So the identification points, like I mentioned to the lateral process of malleus, you can also talk about the umbu, and since the other structures are not so clearly visible, you can mention the lateral process of malleus, cone of light, and the umbu. See, this is a picture of the two palatine tonsils which are hypertrophied. Now, to diagnose, when you are asked about diagnosis, see, we can see plenty of follicles over here. So if you are asked for the diagnosis, you can directly say acute follicular tonsillitis, or you may even say chronic follicular tonsillitis, because that difference is made clinically. You can answer both. Now, so if you write acute follicular tonsillitis, your management will change. You will talk about IV antibiotics in case of acute. You will talk about IV fluids and other conservative managements if you write the diagnosis to be acute. But in case of chronic tonsillitis, again, and your treatment pattern will change. If it is an acute on chronic tonsillitis, your treatment will be this, and if it fits the Paradise criteria, then your treatment will be tonsillectomy. So whatever the diagnosis you write in this in case of this picture, you should be able to write the management accordingly. You can freely write it as acute follicular tonsillitis or chronic follicular tonsillitis. You may be asked about the other types of tonsillitis that you get, like the acute parenchymatous tonsillitis and so on. I am not going into details of those. So directly coming to the next picture. So it has been asked what is the procedure being done. So you can see this is a indirect laryngeal mirror. We have pulled out the tongue with our left hand and inserted the mirror, and we can see the mirror image of the vocal cords, the pyriform fossae, no sorry, not the pyriform fossae, the supraglottic area over here is a little visible. So this is a indirect laryngoscopy to answer what the procedure is being done. So what are the structures seen here? You can only see properly you can see the vocal cords here, but other structures that you can see are the base of the tongue, the valleculae, the pyriform fossae, the array epiglottic folds, and very rarely you may be able to see a few of the tracheal rings as well, although rarely. Now coming to the next X-rays, as you can see, both the anteroposterior view and the lateral view of the neck and the chest and the upper part of the abdomen can be seen. And since the radio-opaque foreign body is closer to the vertebral column here, so this is a foreign body in esophagus. We can only give the diagnosis if both these two views are given. If only this anteroposterior view is given, we can give the diagnosis as a foreign body in aerodigestive tract. So what is the management? Management is esophagoscopy under general anesthesia. So this picture, we have been asked to describe the picture. So this is a lateral oblique view of mastoid, also known as Schuller's view. So what is the type of pneumatization shown in each? You see, this is the opening of the bony external auditory canal, and the mastoid here is more or less opaque. You can say this is a sclerotic mastoid. And here the air cells are more or less aerated. This is the bony external auditory canal opening. So this would be a pneumatic or a cellular mastoid. Now, in this picture, you have been asked to identify the instruments. So the instruments that you can see are, this is the Bull's lamp, this is your head mirror, and this is an oral speculum. Sorry. So what is the use of this instrument? Here we are examining the external auditory canal by using this instrument, both external auditory canal and, if possible, the tympanic membrane as well. Then coming to the next picture, so it has been asked to identify this instrument. This is a St. Clair Thompson adenoid curette with cage. So what is the use of this instrument? Adenoidectomy. Here you may be asked about the cross questionings on both adenoidectomy, adenoid hypertrophy, adenoid facies, as well as tonsillectomy. So then coming to the next picture, it has been asked to identify this instrument again. So this is a Thudicum's nasal speculum. So what is the use of this instrument? You have to write anterior rhinoscopy. Here you may be asked what structures you can see by anterior rhinoscopy. Now, Thudicum's nasal speculum, the most important use is anterior rhinoscopy. You may also require Thudicum's nasal speculum for septal correction surgeries, namely SMR and septoplasty. So you may be asked cross questions about those procedures as well. So this was Thudicum's nasal speculum. So then again, coming to the next instrument, so this is a tracheal dilator. So what is the use? It will be in tracheostomy operations, even in post-tracheostomy situations. In case of a constricted tracheostoma, we may need the tracheal dilator for insertion of tracheostomy tube. So here again, you will maybe ask cross questions about tracheostomy. So what is the, so then coming to the next picture, this is an oral syringe. It is used in syringing for the removal of wax or foreign bodies from ESC. Okay. Then coming to the next instrument, this is very important. This is Tilly's nasal dressing forceps. Why is this very important? Because you always have to differentiate from an Hartmann's forceps, dressing forceps. So as you can see, this part has no teeth in Tilly's forceps, no teeth. And important thing to note here, there is no catch as well, although Hartmann forceps also doesn't have any catch. So what is the use of this instrument? Again, the best possible answer, to keep it short, you have to say anterior nasal packing. You can also use Tilly's forceps to remove foreign body from nose or even external auditory canal. However, that is not the primary instrument that we prefer to do those things. Then coming to the next picture, so this is a tonsillar snare. And what is the use? To avulsion of, it is used for avulsion of lower pole during tonsillectomy. Okay, so here again you will be asked cross questions on tonsillectomy. Then coming to the next picture, so you have been given a pathology of the external auditory canal. So I'll just talk about the diagnosis and the management of this case. So this is a keloid of the external ear or pinna. So how will you manage this case? Now both options are available to you. Both medical management is available and surgical management. For medical management, we can go for intralesional corticosteroid injection, and for surgical management it is excision. Then coming to the next picture, so what is the diagnosis, it has been asked. So this is a subperiosteal abscess in the mastoid area, which is commonly termed as the Lux abscess. So what is the management of this case? Any abscess, the best management that you can do is an incision and drainage. Here again you may be asked about the complications of chronic otitis media, because this is the commonest complication of chronic otitis media, a subperiosteal mastoid abscess. Then coming to the next picture, so to identify this instrument, this is a Boyle-Davis mouth gag. So in which surgeries? So you can write tonsillectomy. It can be used in any surgery that you perform in the oral cavity, and even in adenoidectomy. So coming to the next picture, it has been asked to identify the pathology. So this is a Bell's palsy. Now to determine the side of the palsy, see in the first picture you can see the although the forehead part is not clear here, the orbicularis oris is functioning properly. As you can see the groove here, and this part of the face, the left side of the face, is more or less expressionless. The orbicularis oris is also not functioning properly over here. So this is a left-sided Bell's palsy. Left. Again coming to the right second picture, here again as you can see the facial expressions are more or less prominent on this side. So this is a right-sided Bell's palsy. Then coming to the third picture, this again is a left-sided Bell's palsy because the expressions are more or less present in the right half of the face. So what is the cause? Most common cause of Bell's palsy is idiopathic, and an important thing to note, this is a lower motor neuron type of facial palsy. So you may be asked cross questions about the facial nerve function tests. Like the Sharma's test. You may be even asked questions regarding other cranial nerves. So these are the cross questions you can expect from this picture. Then coming to the next picture. So it has been asked to name and describe the positions shown. As you can see, there is a sandbag placed between the shoulder blades and there is extension of the neck. So this is a Rose's position. As you can see, the Boyle-Davis mouth gag and the Draffin's bipods have been applied in this picture. So this surgery is tonsillectomy. So coming to the next picture. So this is adenoid facies shown in this picture. So this is adenoid facies. So describe the features. The most important feature that you can see in this diagram is the open mouth and the dull expression. Open mouth. So the other important features like the high arched palate and the crowding of the teeth, upper incisors, those obviously are not clearly visible in this picture, but since they are the features of adenoid facies, you have to mention them as well. And the nose, although it should be pinched up a bit, or that is not very clear in this picture, and there is a little bit of atrophy of the alae nasi. Then coming to the next picture. So name the maneuver shown. This is Trotter's maneuver. Now what is it used for? It is used as an initial management of epistaxis. So what do we do in the Trotter's maneuver? As you can see, it has already been described in the picture. We sit and lean forward slightly and pinch the nostrils and breathe through the mouth. So this is Trotter's maneuver. An important cross question that you may ask with this. See, Trotter's maneuver is totally different from Trotter's triad. Trotter's triad is something which you encounter in case of nasopharyngeal mass, usually carcinoma. So what are the parts of the Trotter's triad? So it comes with an unilateral facial pain, which is the supply area of the trigeminal nerve, conductive deafness, and palatal paralysis. Then coming to the next picture, it has been asked, name the test being performed. This is Rinne's test. So what is the use of this test? It is to check it is basically a comparison between the air conduction and bone conduction of the ear. Now, important cross question that you may be asked in this picture is, what is Rini positive, what is Rini negative, what is a false positive Rini, what is a false negative Rini. Please go through these situations very carefully, because this is a very important question, not only for your OSCE, but you may be asked in your practical viva as well. Then coming to the final picture, so it has been asked, what is the diagnosis? Since this is a for your level, it is better to answer this as a deviated nasal septum. So coming to the treatments, deviated nasal septum has almost no role in no medical treatment, has almost no medical treatment. So you will directly talk about the septal correction surgeries, namely the SMR and septoplasty. So you need to know about the differences between SMR and septoplasty, and other cross questionings regarding deviated nasal septum. So this is more or less to give you a proper idea about the kind of questions that you may encounter during your OSCE table in the ENT final examinations. So hope you can clear that table with flying colors.